News emerged earlier this week of Otago research that showed quitting smoking does not necessarily mean gaining weight. It's the latest finding from the Dunedin Multidisciplinary Health and Development Study after a 17-year follow-up of people who quit smoking. Dunedin School of Medicine Professor Rob McGee joins us with the details. Good evening.
Good
Rob, tell us about the research and who was studied.
Oh, thanks for the opportunity to talk about it. The people in it were the participants in the Dunedin Multidisciplinary Health and Development Study, and they've been followed up over the lifetime now. They're about 40 years of age. And we're very interested in following up the smokers. So we've followed up the smokers, those people who were smoking at age 21, and followed them up until they were 38. And we're interested to see what the history of smoking was in that group.
Yes, what were you aiming to discover?
Well, it's part of a broader study of just quitting behaviour, and what we're very interested in looking at are barriers to quitting in that study. What we did in this study was really to look at one of those barriers, which is the fear that people have that if I quit, I'm going to put on weight. So maybe the best thing for me to do is not quit. What we wanted to find out was what actually happened to people's weight when they quit.
So what were the findings?
Well, we found that there were 330 smokers at age 21. About 40% of them had quit by the time we followed them up, so that's quite a good quit rate. On average, those smokers gained about 5 kilograms over the period of time, but that 5 kilogram weight gain really just took them back up to where they would have been if they'd never smoked in the first place. So it was quite an interesting finding, I think. Yeah.
Were researchers surprised by that finding?
Well, I think we were surprised by two things about the results. One was that smoking doesn't necessarily help people lose weight. In fact, the weight of the smokers and the non-smokers all went up over the time that we were following up these people. So smoking doesn't necessarily mean you're not going to put on any weight. I think we're also surprised because earlier research had suggested that the weight gain might be more than that. Some of those studies had involved people who have sought treatment or health service users. I think the strength of the Dunedin study is it tells you what's going on in the community. So, you know, we're very reassured by that these results are real, if you like.
Now, as you've said, the quitters' weight returned to the same level as that of people who of a similar age who had never smoked in the first place. Does the weight rise initially?
What we found was that the weight sort of, as you say, initially they put weight on, but what happened after that is they tended not to put more weight on. And I think that's a very positive message in a way, because what it's suggesting is, well, if you're going to quit, you know, the weight's not going to keep piling on forever. It's kind of, there's a limit to what's going to happen. Yeah.
Apart from that, what other things can people who are thinking about quitting take from these findings?
Yeah. Well, one of the things I think they can take is, with the awareness that they are going to put on some weight, I mean, you can possibly prepare for that. So you might think about changing patterns of eating or physical activity. But I think the other thing to take from that is that the health risks of that small weight gain are far less than the health risks of continuing smoking.
Now, you study tobacco control. What more would you like to see happen in the area?
Well, I think two things. One is we really do need to keep looking for innovative ways to help people quit. There's a lot of smokers who want to quit, and we need to help them quit. New Zealand has a goal to reach smoke-free by 2025, and one of the things I'm really keen to see, and a lot of people in public health are really keen to see, is the government introduce plain packaging as they have in Australia. And I think that's going to have a really big effect on smoking rates in the country, and young people will grow up smoke-free, which I think is really important.
Does your study finish here?
No, we're going to keep going. We're going to keep looking at other factors involved in quitting, and for example, we've got information on mental health, confidence in quitting, number of times people have tried to quit. So we want to get a broad picture of what it's like to quit smoking. I mean, it's a very difficult thing to quit, and we want to be able to describe to people what they might face and how best to overcome those obstacles.
Dunedin School of Medicine Professor Rob McGee, thank you so much for your time.
Good. Thank you.